Let's kick things off. Hypertension is a word we hear all the time in healthcare, but how would you explain it to a patient who's never heard of it before?
I usually say it's when the pressure of blood against your artery walls stays too high, even when you're at rest. Most guidelines call it hypertension if your systolic is 140 or above, or your diastolic is 90 or higher.
That's a great summary. And it's wild how many people have high blood pressure but feel totally fine, no pain, no symptoms, so it just flies under the radar.
Exactly, which is why it's often called the silent killer. Many people only find out when something more serious happens, like a heart issue or at a routine checkup.
Hearing silent killer always gives me chills. What are some of the big dangers if it's left untreated?
Long-term, your risk goes up for things like heart attacks, strokes, kidney failure, even vision loss. The scary part is, a patient might feel perfectly normal right up until a major complication.
That's what makes regular screening so crucial, especially since these complications can be life-changing or even fatal.
Absolutely. It's not just the physical dangers either. Having uncontrolled blood pressure can affect your day-to-day well-being in subtle ways.
Let's talk about that day-to-day side. It's more than just a number on a monitor. How does hypertension creep into someone's everyday life?
People might get headaches, feel unusually tired, or notice dizziness. Sometimes just walking up the stairs can leave them short of breath. And the emotional side is big too. Many patients get anxious from constantly checking their blood pressure or worrying about potential complications.
It can really snowball suddenly. Sleep gets harder, stress builds up, and even the idea of taking medication every day can be overwhelming.
And then there's the frustration of changing your diet or habits. I've seen patients get upset about cutting salt or trying to exercise more, especially when family members don't understand what they're going through.
All those challenges make me wonder, why is hypertension so common? What are the main risk factors that listeners should watch out for?
Genetics play a big role, but age is huge. Anyone over 40 is at higher risk. Add in obesity, not moving enough, eating salty foods, stress, smoking, and alcohol, and the risk just stacks up. If you have diabetes or kidney disease, that's another layer.
And sometimes, it's not even lifestyle. A hormonal disorder or certain medications can push blood pressure up too. No wonder it shows up everywhere, from clinics to community settings.
Exactly. It's usually a mix of factors, which means there's no one-size-fits-all solution. But the good news is, treatment has come a long way.
Let's dive into that. For someone newly diagnosed with hypertension, what's the first step? Where do you even start?
Lifestyle is always key. That means following a DASH diet, cutting back on salt, getting at least 30 minutes of exercise most days, quitting smoking, and managing stress sometimes with yoga or breathing exercises, but often medication is needed too.
And today, there are so many options. ACE inhibitors, ARBs, calcium channel blockers, thiazide diuretics, plus newer tech like smart BP monitors, and even procedures like renal denervation for tough cases.
That's right. Digital health tools, combination pills to reduce the number of tablets, and targeted therapies like baroreceptor stimulation, these are changing how we manage blood pressure. It's really about finding the right mix for each person's routine.
Before we wrap up, I think it's so important to talk about how we communicate all this to patients, especially for those preparing for OET exams. Any tips for clear and compassionate messaging?
I always remind patients that hypertension is manageable, not a life sentence. I reassure them that lifestyle changes matter as much as medication, and I'm careful to explain never stop meds suddenly, and follow-ups are vital to prevent complications.
I love that. Using simple words, offering encouragement, and really partnering with the patient makes a huge difference, especially when you're helping someone adapt their daily routine.
Absolutely. And getting the family involved can help too. It makes those lifestyle changes more sustainable when everyone's on the same page.
As we close, it's a good reminder that while hypertension affects millions, early diagnosis and teamwork really do change outcomes for the better.
Totally agree. With all the tools and support available now, people can live full, healthy lives, even with high blood pressure, as long as they stay informed and proactive.
Couldn't have put it better myself. Thanks for sharing your insights and making this topic so approachable for our listeners.
It's been